Hi, I am Sheila Caldwell, and I'm the founder and president of the Heart to Heart Foundation, which is part of several coalitions here in our area, including the York County Interagency Coalition. We're also part of the Impact York County Coalition, and we're part of the Eat Smart, Move More York County Coalition. And what is so exciting that has come out of what we're all experiencing right now is behind the scenes, there are nonprofit and community organizations all over the state, specifically here in the York County area, that are coming together, and we're having conversations about what are the critical needs in our community today, and what do we see that we're going to be facing in the future, and how we can work together to bridge that between the needs that we see in our community, the resources that are available, our business community, our community leaders, and bringing everybody together so that we can serve the families here in York County. And I'm excited because I have two of my favorite people on here with me today. Liz Duda, who is pretty much Eat Smart, Move More York County. She's also represents the Federal Reserve, but when we think about Eat Smart, Move More York County, I mean, she has got it all together, and she can answer a lot of questions for us. And Phil Ford, who is Eat Smart, Move More South Carolina. So when it comes to the conversations about the issues about food and where we're headed, I know you all are having conversations on a much broader scale. Recently, I know, Liz, you had a brainstorming session with the Impact York County Coalition leadership about where we're headed. So let's start with you, and let's talk about where we are in York County. What all are you seeing?
So Eat Smart, Move More York County is fortunate to be working with many community partners who have important initiatives throughout York County to address right now food insecurity in light of the COVID-19 virus. So we know that with the economy, with many people being laid off of their jobs or having fewer hours, and with kids being out of school, they're not getting the meals that they were getting in school. So many groups have started working both on their own and working together to try to address those needs. So we've got multiple community partners that we are working with and seeing what they're doing and seeing how Eat Smart, Move More York County can support them.
And in case somebody's not familiar with Eat Smart, Move York County, what's your mission? Tell us a little bit more about the organization.
Yes, so we are the local coalition of Eat Smart, Move More South Carolina, and Phil Ford is on here from Eat Smart, Move More South Carolina at the state level. We're the York County Coalition, and we are working to promote healthy eating and active living in York County. And we do so in a way that would be sustainable.
Which we know at the heart of good health is that access, and also, you know, and some of that is choice that we make, but lifestyle choices, but it goes beyond lifestyle choices. A lot of the conversations we're having right now, because April is National Minority Health Month, is, you know, there's been some pundits that have said, well, it goes back to healthy eating and exercise. And yes, that's true on some level, but that problem goes a bit deeper in many communities. Phil, statewide, here in the state of South Carolina, what are you all seeing when it comes to food disparities in our state?
Well, and thank you for having me first. I appreciate this opportunity to talk with you all. You all are doing amazing work in York County. And I'm glad to be just a small part and able to join the conversation. But what we're looking at is we're looking at the food system as a whole. Eat Smart, Move More South Carolina has typically been the access point, trying to get more access points out there. But what we're looking at is making sure that not only are healthy foods accessible for folks, but they're also affordable for folks. So we're looking at the socioeconomic side of things too, for folks to make sure that not only do they have, not only are they no longer living in a food desert, but they can afford the fresh produce. And that's something that Liz commented on just a few minutes ago, that's even disrupting people's lives even more today because of unemployment rates going up and trying to equitably work on that that end of things for healthy food access and affordability.
And one of the things that we're seeing here specifically in York County, and Liz, you can probably comment even further on this, but within the last few weeks, we have seen long-term food pantries having to shut their doors or reduce their hours. So I would imagine that is putting an even greater strain on access to healthier foods. What are you hearing here in our area?
Yes, so we've been in contact with several food providers. One, for example, there's a group called the Community Cafe, which has a mobile food truck, which reaches out to different communities. It goes into Lake Wiley, Fort Mill, Rock Hill, and it's starting in York on April 14th. They've reported that their Rock Hill numbers doubled in the last month, and that they have seen an uptick in Fort Mill. So they are seeing increases in demand.
What are you seeing on a statewide level when it comes to our food pantries, those that serve the needy in their communities? Are you seeing this replicated in other parts of South Carolina?
Yes, absolutely. We are, but what we're also seeing is the communities coming together to solve these issues. You know, in my position at Eat Smart, Move More South Carolina, I have the ability to document and to provide best practices for individuals. So when there are situations where a volunteer or staff member may get sick, making sure that we adjust the way that we're working and really look at having teams. So not everybody is working together at one time, because if that's the case, we've got to stop production altogether, right? So making sure that there are those small things that when you say it, you kind of, oh yeah, that makes sense. But when you're in it and making sure, seeing these numbers that have doubled, you know, you want to make sure people are being served, but really doing this in serving and addressing the short-term needs, but also of the long game is how we want to make sure from the state level that we help support and prepare our local coalition.
I know our local school districts are still feeding students breakfast and lunch, and we have a local organization, it may be in other parts of the state as well, something similar to it called Back the Pack, that they provide food kits for the weekend. And their executive director was telling us even last week that initially, you know, they were very blessed. They were excited because they changed what they were sending home with the kids. So there was a lot more healthier options for the weekend. And they had enough food to get them through to June. I mean, that's huge. It was, they had budgeted for 800 children. So they were so excited at the beginning of the year that we have enough food to get us to June, which when you're a nonprofit and you're, you know, raising money to buy that food, to provide it. I mean, that was exciting news. That was a win, right? And then COVID-19 hits. And within a span of 2 weeks, they go from serving 615 kids to almost 1,000. So now they're over where they were. So they know that there's a possibility they could deplete their resources very quickly, because as they shared with me, that every time they go out to serve a family, they find another family in need. And in our area, in South Carolina specifically, from what we have heard from DHEC, as well as from some doctors in the area, I just did an interview with a leading cardiologist last week, South Carolina has not seen our peak yet. We are looking at around April 29th. York County specifically, from what I've been told so far, and that may have changed recently, but what I've heard so far is we haven't seen ours and probably won't till early to mid-May. So we haven't really begun seeing that apex rise of those cases and then the unemployment taking a bigger hit. And I believe in some of the materials that Liz shared with me, when we look at the numbers of unemployment claims in South Carolina, we're looking at families who just 2 months ago probably donated to the food bank, and now they're in line at the food banks. what are we looking at over the next, right now, we're probably looking at 6 weeks until we get to June. Phil, what are you seeing statewide?
Well, I do want to mention food insecurity isn't new to South Carolina. We have been facing this for years and years. We export a lot of the produce that we grow here, but roughly in the state of South Carolina, 1 in 7 are food insecure, which means that they don't know where their next meal is coming from or have reported that in the last 12 months. That's a frightening statistic, especially when the rate of children is much higher than adults. So keeping that in mind, knowing that folks are going to be out of work and there's going to be a turnaround time for unemployment to start hitting folks' accounts and different things like that. That's why it's so important for groups like Impact York County and Eat Smart Move More York County to be working together with government agencies. But on the state level, I'm very happy to report that the Department of Social Services has applied for the waivers at this point that they're able to apply for. They have gotten a waiver to expand the monthly amount to the maximum amount for households, also for interviews. So they're not in-person interviews, they're over the telephone. So making sure that folks have access during these uncertain times. It's really important that folks apply. It's taking some time. I just saw an email this morning that, you know, sometimes you get on the phone and it'll disconnect, or, you know, the systems aren't used to this kind of overload. So making sure that folks stay persistent is really important. But, you know, we're seeing the Department of Education really step up and support the autonomous local school districts, right, that have their own control over the local school districts. So they're really stepping up, trying to find volunteers to support the local school districts. So Director Leach at DSS and Superintendent Spearman have really been working hard on this. Ron Jones from the Department of Education, the Director of Health and Nutrition at the Department of Education, has been great. We're planning on working with them to provide webinars over the next little bit to really provide best practices and guidelines for folks to streamline efforts, to, you know, support the staff, because, you know, they're working as hard as we possibly can, and as hard as they possibly can to make sure folks' needs are met. But, you know, it's going on a month now, and folks are getting tired. And, you know, when folks get tired, their immune systems go down.
Yes.
So, you know, it's a little cyclical. So we've got to make sure that we're working smart while working hard.
And Liz, specifically here in York County, talk to us about what we need, what efforts are being made, what is the landscape here, and how can people get involved?
Yes, so Phil has mentioned a couple of times how Eat Smart Move More South Carolina is gathering resources and putting out information. At a local level in York County, that is also being done. I would like to point out that Rivendell Farms of the Carolinas has created, and that's a nonprofit in this area, has created an amazing map where you can go online and find food resources near you. So they are working to make sure that people can see where they can get the food, access to food. They have access to free meals in one map, and then there's farms and farmers markets on another interactive map. So in this area, we can go online and see where resources are being offered to people. Also, many others so we're gathering information and putting it out, so you can find other resources on our website.
That is awesome. And I know that there's been some of the food pantries that we've heard from that have had to reduce their hours or, you know, change the way that they're operating. And some of that is because the shelves are running empty. And I know early on during this pandemic, everybody was racing to the grocery store and trying to find resources. So you know, trying to get items in or trying to donate items, you know, it was getting harder. I think that's perhaps gotten a little bit better. But one of the things I wanted to chat about specifically, because I know you all are about um, feeding our body the kind of food that can help us protect our immune system and also help prevent those diseases and risk factors that cause the worst outcomes in the COVID-19 patients. So if someone wanted to donate food to a food pantry, what kind of foods right now should they be looking for? Do we have pantries that can take fresh produce? Do we have, you know, what are they looking for right now? How can people help?
On their websites, are we still on here? On their websites, people are saying what their needs are. So if you go specifically to a community cafe or the Clover Area Assistance Center, they're saying specifically what their needs are. So of course we encourage the healthier items. So if you're going to be buying something, we would encourage the lower sugar, lower sodium, but so specifically it says what they need on their websites. And there's also food pantries. So you could donate to the Second Harvest of the Carolinas. They're accepting foods and they list on there what their needs are. And then other places have said that they would accept money. They don't want their donors to risk going into the supermarkets. So they encourage donors to give them money and they would make the purchases to lower their customers' risk.
And I would imagine too, going through some place like Second Harvest, there's a much greater buying power there, you know, as far as the amounts of foods that they can get. And one of the things that I will do is when we post this, I will link to that map, the Rivendell map. And I was trying to get to it on the share screen, but I didn't have it saved off correctly. So, but I will post it when we post this this interview. So,
and that map also says what local needs are. So there's a button on there where you can click and it says this group needs volunteers, this group needs funding, this group needs foods.
Because that's one of the, go ahead.
Yeah, one other thing that from a state level standpoint that we're looking at doing with partnering with the South Carolina Food Policy Council is to urge organizations to buy local, to buy from farmers directly. Because not only are you helping the local economy and keeping jobs, but you're putting the freshest produce that you could possibly get onto folks' tables. So we're looking at that. We're putting together a document for organizations around the state to use to contact local farmers. That will include Clemson Extension agents, that'll include the farmers themselves, the Carolina Farm Stewardship Association farms. You know, we're looking at this holistically, taking a step back and saying, how can we do this? We've never experienced anything like this before. So we've got to be a little innovative and try new things. And, you know, working with groups around the state, with the Hospital Association and the South Carolina Office of Rural Health, looking at groups redirecting funds in some way. If things that they're doing can't currently happen, how can we still assist these communities? And we're in conversation with them to continue support in the food access area and the healthy food access area to make sure that not only are folks getting the right food in their body, but they're also supporting local farmers.
Go ahead.
So the Catawba Farm and Food Coalition is a group in our area that they have one group where they go out and they pick up goods from local farmers and then they deliver it locally. So it's an online farmers market called the Catawba Fresh Market, and you can go on and order from farmers and then it's delivered to a location near you. And also I wanted to point out there's the Charlotte Policy Council, which has just started a weekly Ask the Experts series with local food policy people in the food policy area, and that's online on Fridays, so you can find that information on Facebook. And then you can also purchase directly from local farms. For example, the Tega Hills Farm has a farm stand there, so people can access foods, even fresh foods, even at this difficult time.
And that brings up a very interesting conversation, because I think all of us felt a pang when we watch the news and we see farmers who literally their crops are rotting in the field, or we see dairy farmers who are having to just pour milk out because the schools aren't in session, the milk isn't being used, and they're losing that. And to a point, I think we all look at one another and say, you know what, we have some of the smartest people in the world in this country. There has got to be a way we can figure this out, because there is no reason why, just my opinion, there's no reason why anyone right now should be going hungry. There is food, but it's how do we get that food? And it would help the farmers. I know the farmers would much rather be paid for their crops than have to take, a government subsidy to make up, because they work hard to grow that food. They have to battle nature to grow that food. And it's a sense of pride for them, to have that and to provide. But there's got to be a way that we can do what you're both talking about doing, because we know that the more nutritious food we can get into families, children on up, even into seniors, the healthier we can get our communities. That's going to help with so many different issues. And I know with Eat Smart Move More, right now, even the physical activities, I think our tendency is, because we're quarantined, we kind of want to sit and play video games or watch TV all day, and we forget, no, you need to get outside. You need to get some of that vitamin D and that fresh air, and, get out and spend some time outside. And I know, there's different orders depending upon where you are. And then, of course, mental health, because I can imagine as this goes on, the stress, the changes that we've all had to go through. And I know you, Liz, you have a special program tomorrow. I wanted to make sure we plug that on April the 14th, that people can join Eat Smart Move York County for a really good program.
Yes, so our general meeting on April 14th at noon, you can see the invitation on Facebook or on our website, it's featuring two members of our leadership team, Sarah Kane DaCosta of Synergy Yoga Wellness of Rock Hill, and Janet Wojcik of Winthrop University, and she's also an exercise science expert. They are talking to us about techniques for relaxation and focus that we can use in our everyday lives. So mindfulness and medication. And meditation, not medication.
May need medication before it's over.
Mindfulness and meditation. And then Sarah is going to end off the session using leading a guided meditation. So anyone, we have up to 100 lines. Anyone is invited to participate.
That is awesome.
Okay.
And I'm sure we'll include that link on there too, to that event, so people can sign up and get that information. Is that open just to the Eat Smart Move More York County members, or are you going to accept folks from the general public to hop in there?
We will accept folks from the general public. The first 100 people are welcome.
You got it. You got it. And, it's very important to remember, what we put into our bodies and what we do for our bodies really is that foundation of good health everywhere. And, as we're trying to navigate, and I know, Phil, you had mentioned, volunteers getting tired. And unfortunately, I think in a lot of our nonprofit and community organizations, most of the volunteers are retirees during the day. And those are the people that are at higher risk for complications from COVID-19. So they've had to stay home. But what I have been encouraged by are the number of college students who have stepped in. And so we would, encourage those on a healthy level, all things being considered, making sure, you're following the guidelines. But it's great to see the younger adults and the college students stepping up and saying, this is our community. We realize we've got a need here, and being a part of those things. I know, Liz, you and your kids have been out doing some extra volunteering. What has that experience been like? I mean, you're homeschooling, but I think that adds a different to me, it's a bit cathartic to be a part of the solution in a community when there's an issue going on. What's that been like for your kids?
Yes, so it's a good experience. We are fortunate to have found a place that can accept us, and so we have gone into I mentioned the community cafe. So they have welcomed us. They provide us with instructions. So they've given us what the guidelines are before we get there. So we read that, so we knew what we were going for. We get in there. We are required to wash our hands when we walk in the door, put our gloves on, change our gloves whenever there's a change of jobs. We're wearing our masks right when we walk in. We have to stay 6 feet apart from everyone, including our family members. So we're all stationed at tables throughout the room. So they're being very clear to us, giving us very good guidelines about how we are supposed to act. And so for my family, I've got 3 children. It's wonderful for us to be able to work together and see that we are supporting the community, so volunteering and giving back because we are able at this time. They did, as you said, they said they had mostly older volunteers, so they're welcoming less at-risk people into the volunteer locations.
Yeah, I can understand that. So as we close, any parting thoughts? Bill, let's start with you.
Yeah, no, thank you again for having us. But one thing that I do want to mention to make sure, it was a comment that you said that I absolutely agree about. We live in the United States of America. No one should be going hungry. And working with our farmers, I think a big piece of this is really making sure the information that is put out is relevant to different groups. You know, we see, 25,000 veterans in the state of South Carolina have reported being food insecure in the last year. African-American and minority communities see it at a higher rate. Children, so making sure that there's information relevant to families with children, to minorities, to the military community, to the veteran community, to make sure that they know it's okay to say you're not okay right now. Mm-hmm. We're in a very tough time, and to know that it's okay to apply for SNAP and be on SNAP. It is okay to go to the local food bank. That's why we're here. That's why we're doing this work. When I first started at Eat Smart, Move More, I was like, I'm the advocacy. Loved. But I think my passion has changed to really eradicating food insecurity in the state and in our country. I'm very passionate about it, and I'm grateful to be a part of some of the work that y'all are doing in York County. So again, thank you for everything that you're doing. Sheila, Liz, thank you. We couldn't do it without you in York County, so thank you. But, if anybody has any questions or want to be a part of the statewide food insecurity coalition, we have gathered about 130 organizations. Please shoot me an email. My email is phil@eatsmartmovemoresc.org. But yeah, again, thank you so much for all that you guys are already doing and raising awareness. That's step one, right? Making sure that folks know that it's an issue. So thank you.
Thank you. And Liz, any closing words from you?
Yes, so Sheila, you pointed out that the governor does consider it to be an essential activity to engage in outdoor exercise or recreation. And so we do encourage people to get outside for their mental and physical health, following the safe guidelines. So we do realize it's important to follow the laws to keep ourselves, our families, and our first responders safe and healthy. So we encourage you to get outside, get fresh air, enjoy, get exercise. So that's one part that's very important to Eat Smart, Move More. The other one, as we've been talking about today, access to healthy foods. So these are very important to our community. We at Eat Smart, Move More York County are very fortunate to have an amazing leadership team, and they're doing so much work in the community. And we also appreciate our community partners. We're grateful to Eat Smart, Move More South Carolina for providing the leadership that you do. And Sheila, thank you, and for the York County Interagency Coalition for bringing us together and allowing us to get out our message. So if you please check out the Eat Smart, Move More York County website and our Facebook page and our Twitter feed, and up and coming will be an Instagram. accounts. So check us out. We try to communicate what we're working on, and hopefully it's useful resources to the community.
And again, check out those pages for resources if you're in need of resources, if you have resources that you can provide, and stay tuned for details coming soon about some of the things that you may see happening in our community to address the food disparities to get us through this tough time. Thank you all. Stay safe. Stay well.
Thank you.
Thank you.